So if you look at your bladder, so imagine that this is your bladder. So you've got your kidneys at the back, they filter the blood, and you've got two long tubes that come down and they enter the back of the bladder, and they've got a little sphincter on them to stop any backflow. So that's what we would call your upper urinary tract, and that's quite complicated, the anatomy and physiology of that. But I think knowing how your lower urinary tract, so this is your bladder and the sphincters. So if you imagine that this is your bladder, it should stay really nice and relaxed when it's filling up. When it gets about halfway full, it should send a message up to your brain to say, hello, can you please start looking for a loo? You should then be able to hold on long enough to finish what you're doing or get yourself to the toilet. And then when you pass urine, your bladder contracts and your sphincter relaxes. And then that cycle starts repeating. So your sphincter closes, your bladder should stay nice and relaxed. So that's what we're looking for normally. A little bit of a different thought on this, people may disagree. I think it just depends on what you're doing on that day, because I know anybody, if you're going out, we probably all have a wee before we leave and we go and do what we want to do. But it's when it becomes a habit. So normally you would go between 4 and 7 times in the day, and keeping a bladder diary will help you work out, are you going a lot more frequently than that? If you can, measuring your volumes, because a normal bladder volume anywhere between 250 mils up to 300, 400 mils. If you're lucky, some people can hold 500. So keeping that diary will give you a starting point, but it's, don't go just in case as a regular thing. So we need to allow the bladder to expand and hold enough. So if you keep going just in case, your bladder volume will actually decrease because you're not stretching it. If you feel that you're going too many times in the day, then what you can do is do some holding on exercises. So what we're trying to do is allow that bladder muscle to stretch up, because as I said, if you're going too frequently, it's just not stretching up at all. So if you time to see how long you can hold on, so when you've got that really strong urge, stay sat down, don't get up and do something, because using your abdominal muscles will increase that urgent need to go. So just see how long you can hold on for. It might be 5 seconds, it could be 20 minutes, and then gradually work up from your starting point to reduce the amount of times that you're going in the day, and to give you that little bit extra time that you can hold on and get to the loo.
The traditional answer that people always get to this question is about 2 litres a day. But depends a little bit upon a person's individual needs. So a bigger person needs more fluid than a smaller person. If the weather's hot, if you're a particularly sweaty person, you might need a little bit more. But the best guide that I think is you should always have a good look at your wee and see what colour it is. And you're looking for something that's a really, really pale yellow, a bit like a pale straw colour. And if it's darker than that, then you're not drinking enough. It means that you're dehydrated. So definitely when you've had a wee, always have a look and see what colour it is. Again, this is another myth buster. It doesn't have to be water. All fluid counts as fluid. There's a lot of concern over things like caffeine containing foods, but they did some really good research a little while ago where they got volunteers to drink 700 mils of strong coffee and 700 mils of water, and they found that in practical terms the difference in the hydration levels was not significant. So even if you're drinking caffeinated foods, you are still getting a good positive hydration from them. However, if caffeine, obviously, if it gives you palpitations or makes you hyper, or you think it irritates you in some way, then don't drink it. But from a hydration point of view, all fluid is fluid. Squash, water, juice, smoothies, tea, coffee. The only thing we don't include is alcohol. Sorry. The other thing to think about is if you're not great at drinking, is that of course you still get fluid from your food. So if you know that you're not great at drinking, then maybe try and make a conscious effort to include more juicy and wet type of food. So yogurts, soups, sauces, watermelon, lovely juicy fruits, jelly. Jelly, of course, is just solid fluid anyway. So there's lots of other ways. Yogurts as well is a great one of getting fluid from your food. And again, if you keep checking your wee, you'll know if overall you're having enough fluid in your diet. There's a couple of other things that I think are important. One is that don't rely on your sense of thirst to stimulate you to drink, because often, especially as we get older, we lose some of our sense of thirst. So you might need to build it into your routine, into your day. Other important thing to remember is you've got to actually drink the drinks for them to do you any benefit. So if someone says to you, are you drinking 8 drinks a day? And you say yes, you've actually got to drink them and not make them and then just leave them to get cold. Another important thing to remember is that your bladder and your bowel are closely connected. So if you're constipated, it can affect your bladder function, and conversely, your bladder can affect how your bowel works.
We're all very aware of what our pelvic floor muscles are and that we should be exercising them, and we probably don't exercise them enough. But this goes for ladies as well as men. So it's really important to exercise your pelvic floor and make sure you're doing it correctly. So a couple of ways to do that. You can do it in sitting, and what you're trying to do is just draw up your pelvic floor muscles underneath you and pull everything up. And if gentlemen are doing it in front of a mirror, obviously find a private space to do this, but you will notice that your appendage will move up and down if you're doing it correctly. It's also important to think about not just strength, but stamina as well. So when you do your pelvic floor exercises, you need to think about holding them for as long as possible, but then also doing a really strong contraction and then a relaxation. And I think one of the other things that people tend to forget about is that the pelvic floor muscles, like any muscles, can become quite tight. So it's important to make sure that you're allowing the opportunity for those to relax as well, because that will also have an impact in terms of initiating stream and maintaining a stream. One of the things that you can think about actually when you're on the toilet, and this is something that we don't recommend that you do on a regular basis, but it'll give you an indication of how well your pelvic floor muscles are working, is to stop your stream mid-flow. And that will give you an indication of whether they're functioning well or not. But like I say, you don't want to get into the habit of doing that regularly. Do it as maybe a one-off here and there, but yeah, not too regularly. Another way for you to access your pelvic floor that you might be able to find a little bit more helpful is if you're in standing, rather than having your feet parallel, turn your feet inwards and then try and draw everything up inside of you. And you will find that that's slightly easier to be able to engage your pelvic floor muscles in that position than if your feet are pointing forwards or pointing outwards. Pilates is a really good exercise. It works the whole of the core muscles as well as the pelvic floor muscles. And I think the nice thing about Pilates as well is it makes you more body aware. So you have a better understanding of how your body is functioning and what's actually going on within it as well.